tip that might be useful for you. In my therapist toolkit, I have a lot of tools to help you with difficult clients as well as easy clients. And I always send out at the beginning of treatment a memo to patients that they have to fill out and bring into the first session. It's how to make therapy rewarding and successful. And it has to do with the fact that a lot of patients drop out of therapy between sessions because they get upset with their therapist or for other reasons. And I'm going to try to persuade you, as you read this memo, to hang in there for an additional session, because if I fail you and you get mad at me and you come in for a session to discuss it, often almost always that leads to a tremendous therapeutic breakthrough. But let's go through some of the reasons you might not want to do that. And then it lists fear of conflict. A lot of people drop out of therapy because they're afraid of conflict and they're mad at their therapist, and so they avoid it. Are you someone who fears conflict and they take off? And if you got angry with your therapist, how likely would you be to drop out of therapy so you wouldn't have to deal with that conflict? And they have to indicate. And then it says, and if you got into conflict with your therapist, how likely would you be willing to come in for one final session to dialogue about that? And they indicate if they're willing. And it lists other reasons as well that they might want to drop out between sessions. As an aside, I created this memo because I did research with one of my Stanford residents, Deborah Safer, and she reviewed the world literature on premature termination, and we found that on pretty much all treatment sessions, as many as 35 to 75% of all patients drop out of therapy prematurely. Therapists are not aware of this. If you ask therapists how many of your patients drop out prematurely, they'll typically estimate 15%. But the actual number averages around 60%. And so it's something that's never been addressed. And so I created this memo to try to address this issue, to let the patient know there's a good chance you are going to try to drop out of therapy. And then here's all of the reasons. And then it lists many different kind of reasons that patients do it. And then at the end it says, and having read all of these reasons, there's two ways therapy can be set up. One is you can just kind of drop out anytime you want. And then the other one is you would agree to come in for a final session anytime you decide to drop out between sessions. You come in and talk it over and ask the patient, which would you prefer? How do you want your therapy to be set up? And then they have to indicate. Then what we did, quite a few patients said they wanted the right just to drop out between sessions. They didn't want to have that duty to come in. And then at the initial evaluation, I just said to them, I'm so glad that we clarified that, because we're not actually offering that treatment here in the clinic. But most therapists in the community would be, love to have you as a patient, and they do set it up that way. But the reason we don't, can you imagine if you came in for a session and the receptionist said, Dr. Burns has decided never to speak to you again. Furthermore, he's unwilling to tell you why. Please go away and never come back. It would be cruel, and I would never do that to you. And by the same token, I'm not willing to encourage you to do that to me either, particularly because when we fail each other, if we talk that over, we can almost always hit a home run. But all that being said, if that's the way you want your therapy set up, God bless you, you've got every right to pursue that. And I've never had a patient say, okay, I'm going to go to someone else. They all said, no, I'm willing to do that. And so again, it's not a 100% thing, but I had many patients over the years who came in and said, I decided to drop out 2 days ago. I was going to call and cancel, and then I remembered that memo. And so I'm coming for my final session. And sometimes it's just something like they suddenly felt better and their symptoms disappeared. And then you can do relapse prevention training and let them know, if the symptoms come back, you can return. But it's just another way to educate patients ahead of time that conflict can and will occur and can be a good thing. Also, as I've mentioned, and I'll show you exactly how this works at lunch, we measure empathy at the end of every single session. Patients fill it out in the waiting room. They leave the scale for the therapist before they go home, and you can see exactly how the patient rated you, how warm you were, how caring you were, how helpful you were, and many other dimensions. Now, after you've empathized and you're getting perfect scores on the empathy scale,